Do start. I'm presenting the topic nocturnal enuresis, and my moderator is Dr. Abhishri Ranjan. What is nocturnal enuresis? It is defined as the repeated voiding of urine into clothes or bed at least twice a week for at least 3 consecutive months in a child who is at least 5 years of age. Epidemiology: approximately 60% of children with nocturnal enuresis are boys. Nocturnal enuresis has reported prevalence of 15% in 5-year-old, 7% in 8-year-old, and 1% in 15-year-old. Causes of nocturnal enuresis: it's the inability to recognize a full bladder, genetics and functional small bladder capacity, abnormal diurnal secretion of vasopressin, detrusor instability, sleep disorders, psychological issues. So how to make the diagnosis of nocturnal enuresis? It's the child must have reached the age of 5 years. This behavior must occur twice weekly for at least 3 months, and it should not be caused by any medical condition. Differential diagnosis: it should be the unrecognized underlying medical condition such as diabetes mellitus, diabetes insipidus, constipation, urinary tract infection, chronic renal failure, spinal dysraphism, disturbance in sleep and consciousness such as seizures, intoxication, and sleepwalking disorders. Adverse effect from treatment with antipsychotic agents. And treatment: toilet training, restriction of fluid before bedtime, voiding before bedtime. Parents do not punish the child for enuretic behavior. Alarm therapy, which is triggered by wet underwear and wakes the child when voiding begins. And rewards for dry nights. Behavioral therapy, condition with bell and pad is the most effective treatment for enuresis, with dryness resulting in more than 50% of cases. Bladder training, encouragement rewards for delaying maturation for increasing times during waking hours has also been used. Pharmacotherapy, desmopressin is used, which is synthetic analog of vasopressin. It reduces urine production at night and its effect lasts up to 8 hours. In most studies, enuresis is recurred shortly after discontinuation of medications. Reboxetine, a norepinephrine reuptake inhibitor with a non-cardiotoxic side effect profile, is a safer alternative to imipramine in treatment of enuresis. Psychotherapy, useful in dealing with coexisting psychiatric problems and emotional and family difficulties that arise secondary to chronic enuresis. And